Welcome to your Health Oasis, your complete healthcare guide. We have already discussed about headaches being one of the most common neurologic disorder and also the classification of headaches in our previous video where we talked about migraine. We will be discussing about the other two types of primary headaches in this video. They are tension headache and cluster headaches. Tension headache is the most common of three primary headaches. It is a chronic head pain syndrome, which is usually described as a feeling of tight band around the head where the pain develops gradually. Tension headaches are classified into episodic, where the pain lasts for less than 15 days a month for at least 3 months, and chronic tension headache, where the headache lasts for more than 15 days for at least 3 months. The triggers of tension headache are somewhat similar to that of a migraine headache. They include increased stress levels, eye strain such as staring at a computer or mobile screen for a long time. Other triggers involve alcohol, straining the neck and shoulder muscles, excessive caffeine intake, or sometimes even withdrawal of the same, cold or a sinus infection. Skipping meals and insomnia are among the other major triggering factors. Let us now see the major differences between tension type headache and migraine headaches, as it is very common to confuse between the two. Primary differentiating factor is the absence of associated symptoms. Migraine headache sets in with so many associated symptoms, which is very minimal or even absent in tension headaches. Photophobia or phonophobia, either of them accompanies tension headaches, but never both. Whereas photophobia and phonophobia are the diagnostic features of migraine headaches. There is pressing or tightening type of pain in tension headaches, whereas throbbing or pulsating pain in migraine headaches. Tension headaches never come in with nausea, unlike migraine headaches, where nausea and vomiting are mostly present. Tension headache affects both the sides of the head, that is bilateral affection, on the contrary to migraine headache, where the pain is unilateral. The pain in tension headache lasts from 30 minutes to even 7 days, and the pain in migraine headache lasts from 60 minutes to 72 hours. The tension headache is not aggravated by movements, whereas in migraine headaches, the person prefers to lie calm and still, which ameliorates the pain. Now let us go through the next type of primary headache, cluster headache. It is one of the rare form of primary headache and also the most painful one. The pain is so excruciating that you may literally wake up at night due to the intensity of pain around your eyes and one side of your head. The signs and symptoms of cluster headache include retroorbital pain, that is pain behind the eyes. The pain is of an excruciating and explosive type. Periodicity is well marked in cluster headache, where at least one of the daily attacks of pain recurs at about the same hour each day for the duration of a cluster bout. The other associated symptoms involve swelling around the affected side of the face, redness of the affected eyes, lacrimation or watering of the eyes, drooping of eyelids of the affected side, stuffy or runny nose. Cause of cluster headache still remain unknown, although studies attribute it to be the hyperstimulation of the nerve pathways supplying the face. People who smoke and consume alcohol are at an increased risk of getting cluster headaches. Now let us see how cluster headache vary from the other two types of primary headaches. Unlike migraine headache and tension headache, cluster headache do not have any specific triggering factors. Men are more commonly affected than women, and there is increased restlessness and irritability seen in people suffering from cluster headache, unlike what we saw in migraine headache, that the people lie still and motionless, as the migraine headache are aggravated by movements. As the name suggests, the pain of cluster headache come in clusters of attack, where the pain lasts for several weeks to months, after which there is a pain free remission period lasting for 3 months or more before another cluster headache develops. Characteristics of pain in cluster headaches involve periodicity. As discussed, at least one of the daily attacks recur at the same time. The pain lasts from 15 minutes to 3 hours. The onset is sudden and usually mimics some serious illness of the brain or eyes, but the pain also settles on its own most of the times, even without medications. The pain is unilateral and mostly aggravated during night times, and the person suffering from pain tend to become restless and move about during the attacks, pacing, rocking, and rubbing their head for relief. Kindly consider to like, share, and subscribe the channel if this information was useful to you. And do not forget to hit the bell icon. Follow me on Instagram for some daily health